Hi, my name is Dr. Kelly Victory. I'm a trauma and emergency physician with a specialty in disaster preparedness and response and the management of mass casualty. For the past 2 decades, I've been in public health, working with and advising Fortune 500 companies, hospitals, schools, and municipalities, developing plans and training them to respond effectively to the worst ever cases, whether that be a hurricane, a flood, an active shooter, or a pandemic. There's no one in America or around the globe who hasn't been impacted by the recent pandemic of COVID-19. While we clearly mourn the lives of all who became severely ill or died from COVID-19, the vast majority of people haven't been victims of the actual virus, but of our response and our reaction to the outbreak. Millions of Americans have lost jobs, delayed necessary medical care, been isolated from family, missed months of school, and been prohibited from worshiping. Now, we find ourselves months into the event, and communities across the country have suffered needlessly and are struggling to find a way out of this mess. My hope is that in this short presentation, I can provide you with information that will allow you to be better informed about COVID-19, and as importantly, more secure and confident to fully return to your lives, your businesses, schools, and places of worship without fear and without limitations. So, what do we know about COVID-19? Well, we know that it's a coronavirus. It's one of 26 major families of viruses. It's named for the microscopic appearance of the proteins that are stuck on the outside of the virus that resemble somewhat of a crown, hence the name corona. Coronaviruses are very common. Upwards of 20% of all common colds are actually caused by coronavirus. We know that COVID-19 is a mild disease in the vast majority of people. 85% of people who contract COVID-19 have few, if any, symptoms at all. Another 10% or so actually become ill the way you might with the flu and need to seek medical care, but only a very small number actually require hospitalization. And although any deaths are tragic, only a tiny fraction have died from this infection. We know that COVID-19 is a novel virus, one that hadn't been previously identified by scientists. But that doesn't mean that our bodies have no idea how to respond to it, as you may have been told. Although you may never have seen this exact virus before, our bodies have seen lots of viruses like it, and the immune system is remarkably capable of adapting. An analogy I might make is that although I've never met you, if I ran into you on the street, I would have a good idea how to interact. I'd know that you're a person, not a tree, a man, a woman, tall or short, and I would have a good idea of how to begin interacting with you, even though I'd never met you before. We know that COVID-19 has the ability to mutate or change its appearance over time. All viruses can mutate, but coronaviruses are especially good at it. The reassuring news is that most mutations end up making the virus weaker or less lethal rather than more. This particular virus doesn't do well when exposed to warm temperatures or to sunshine. It simply can't survive for more than a few minutes when the temperatures are above about 70 degrees, and certainly not when temperatures are in the mid-80s or higher. And finally, coronaviruses tend to be cyclic or seasonal in nature, meaning they have normal increases and decreases based on the weather, typically declining in the warmer months and potentially increasing in the cooler, wetter months. And this is why you may have heard that there could be a second wave in the fall. So, who is truly at risk from COVID-19? We know that not everyone is at significant risk from this virus. In fact, as I said previously, most people, the vast majority of people, will not have any significant illness even if they do contract the virus. The people who we are most concerned about are those who are over the age of 70 and who also have underlying health problems, what physicians call comorbidities. The underlying diseases that we are specifically concerned about are diabetes, hypertension, obesity, and lung diseases like asthma or emphysema. When it comes to risk from COVID-19, overall health is far more important than your chronologic age. In other words, the number of candles on your last birthday cake is less important than how active, fit, and healthy you are overall. Children are at virtually no risk. Only a handful of children throughout the country have had any significant illness from COVID-19, and all of them had serious underlying health issues. In fact, outside of New York City, this virus has essentially been a nursing home problem. The general public has simply not been impacted the way the media and public health officials have led us to believe. Given everything I've just laid out in terms of the nature of the virus itself and those who are truly at risk, I can say that the national response to COVID-19 was horribly misguided. Let's start with the idea of social distancing. Social distancing isn't even an established healthcare concept, and certainly not one in the public health. The whole idea of social distancing was based on a theoretical model explored by a high school student in a science fair some years ago, looking at how an infectious disease might hypothetically spread as the result of potential exposures amongst kids at school. In other words, it was never scientifically based as a method for responding to a pandemic. What is a fundamental public health method for controlling the spread of infectious diseases is quarantine. In quarantine, the sick are isolated, kept indoors, away from others, and those who are at significant risk, the elderly and those with underlying diseases, are protected, say by the wearing of masks in public. Keeping healthy people isolated from one another simply isn't necessary. Masks are intended for the ill, when they will be potentially in contact with others, and for those who are caring for them. Multiple medical authorities, including the World Health Organization, the CDC, the New England Journal of Medicine, have now all acknowledged that there is no scientific justification for normal, healthy people to be wearing masks. In fact, prolonged mask wearing actually increases the risk of disease to the wearer. People tend to touch their faces much more often when they're wearing a mask. In addition, we end up rebreathing particles that our lungs have exhaled, whether it's pollen, dust, virus, or bacteria particles. They are trapped in the mask, and on the very next inhale, we breathe them back in. Lastly, many people are wearing masks other than surgical or medical masks, and many of them are not porous enough to allow carbon dioxide that we exhale to fully dissipate. So on every inhalation, we breathe back in more carbon dioxide. Furthermore, and very importantly, habitual wearing of masks decreases the body's natural immune response. We're supposed to come into contact regularly with foreign things, bacteria, viruses, all kinds of things. And that's what helps to keep our immune systems on alert, working at full capacity. If you limit your exposure to everything by constantly wearing masks or the overuse of hand sanitizers and disinfectants, your immune system in effect says, apparently I'm not needed. I'll go on vacation, take a nap. And it won't be prepped and ready when you need it to mount the appropriate immune response. So what's the real risk of contracting COVID-19? Despite what you were led to believe, COVID-19 has not proven to be as contagious. The recent New England Journal of Medicine study showed that it really takes quite a significant face-to-face exposure to someone who is sick from the virus for a matter of minutes, and even then, transmission is far from certain. There's a very low risk of contracting the virus from exposure to hard surfaces. The CDC now admits that continuously disinfecting surfaces is unnecessary because the virus simply doesn't live for more than a very brief period of time on surfaces. And lastly, there is a very low risk from exposure to children. It turns out that children who actually have the virus in their noses or mouths harbor a very small amount of it. they have on average less than 25%, less than a quarter of the viral load that we find in adults. This may be part of the reason that children simply don't become sick with the virus, but it also means that we don't need to be concerned about being in close contact with them. People wonder what will ultimately keep us safe from COVID-19. Well, let's start with immunity and what that means. The human body has a very advanced and highly adaptive immune system that keeps us safe by fending off a host of potential enemies on a daily basis. Every day, we come in contact with bacteria and viruses, dust and pollen, and all sorts of environmental agents that could potentially harm us. But our immune systems identify those agents as friend or foe, and it sends out the appropriate army to fight it off if it's identified as harmful. If it's a foe that we've never seen before, the immune system quickly creates a specialized soldier known as an antibody that is specifically suited to attack and disarm that foe. Then, those antibodies, those specialized soldiers, stick around. So if we ever come in contact with that enemy again, the immune system can quickly deploy them to the scene. We are now immune to that enemy or disease because we already have the appropriate antibodies to fight it. Now, you may have heard the term herd immunity and wondered what that means. Herd immunity is when the vast majority, upwards of 90+% of an entire population, has already been exposed to something and has developed antibodies, those specialized soldiers capable of fighting that enemy. When nearly the entire population has antibodies, the few people who have never been exposed, who haven't developed antibodies, are safe because this disease simply can't take hold in that community and cause an outbreak because it's fought off and killed before it can spread. For viruses like COVID-19 that are relatively mild for the vast majority of people, herd immunity is sometimes the best approach. In other words, let people be exposed to the disease, knowing that they won't likely become ill, but thereby allowing them to develop antibodies naturally so that another outbreak can't and won't occur. Therefore, one of the best things we can do is allow children to be out and about, knowing that if they do get exposed, they have virtually no risk of actually becoming ill, but they will develop antibodies that will protect them and others from future outbreaks by contributing to the overall immunity of the herd. Another way that we develop antibodies and immunity to disease is through a vaccine. A vaccine is typically created by taking the virus or virus particles that have been effectively killed or otherwise rendered harmless and ejecting those into the body. The immune system sees this foreign invader or enemy and goes about creating those specialized soldiers or antibodies that allow you to fight the virus off if you ever come in contact with the live version in the future. Unfortunately, waiting for a vaccine to be developed before we return to our lives simply doesn't make sense. Although several companies are currently working on developing a vaccine for COVID-19, there is certainly no guarantee that they will be successful or that it will be available anytime soon. There are many, many viruses that have been around for a lot longer than COVID-19, for which scientists have never been able to develop an effective vaccine. HIV, Ebola, norovirus, herpes, Coxsackie virus, just to name a few. So waiting for a vaccine, although it may come for COVID-19, just isn't realistic. What about other medications or treatments for those who become significantly ill from COVID-19? There are several medications currently being studied for the treatment of COVID-19 infection, one of which has been around and used safely for more than 60 years for the treatment of malaria, as well as for rheumatoid arthritis and an autoimmune disease called lupus. Fortunately, more and more doctors around the world have been using this drug for patients with COVID-19 and treating those patients early on in their illnesses So we are gathering a tremendous amount of data that will allow us to say with certainty that it is effective. One of the greatest tragedies of the COVID-19 pandemic is that through it all, fueled by the constant fear and panic sowed by the 24/7 news cycle, by politicians, social media, and by people who are perhaps well-meaning but are simply misinformed, people have failed to trust their own immune systems and common sense. We know the things that are most useful in assuring that our immune systems are able to operate at peak efficiency: healthy diet, adequate sleep, regular exercise, exposure to the sun, taking extra vitamin D and vitamin C and zinc, particularly during cold and flu season. Managing stress is critically important, including maintaining school routines for children, social support, gathering with friends and family, the ability to worship and to join in the fellowship of your congregation. It always makes sense to follow reasonable hygiene guidelines for washing hands, particularly after using the bathroom and before meals, using a tissue when coughing or sneezing, and cleaning common household surfaces. But healthy people wearing masks, avoiding social gatherings, and disinfecting the legs of chairs and doorknobs and windowsills wasn't necessary before COVID-19, and it's not necessary now. The COVID-19 response and everything that went with it, the shutdown, social distancing, masks for the healthy, continuous disinfecting, was unfounded. It wasn't based on scientific evidence, and frankly, it was profoundly damaging to the lives of millions of Americans. The good news is that there's no need for a new normal. The old normal was perfectly safe. It's time to take our lives back, to return to school, to church, to our families and our friends, to get businesses up and running at full capacity, and to trust our immune systems to do their jobs. I sincerely hope that armed with the information you've heard from me today, you will feel better informed and more confident to return to your lives with conviction and without fear. God bless.